Caitlin Ryan. I'm the director of the Family Acceptance Project at San Francisco State University. I want to give you some background information on our work over the past 20 years, talk about some of our resources, including the new resource that we've developed with the Upswing Fund. One of the things I think that is surprising for people to learn is that before we started the Family Acceptance Project 20 years ago, no one had studied the families of LGBTQ young people. And families were all seen as rejecting and not capable of learning to support their LGBTQ children. They were served alone and primarily through peer support. So there weren't services for parents and caregivers. And unfortunately, today, there's still a widespread lack of services for diverse families with LGBTQ children. What we learned from our research is that families have a powerful impact on their LGBTQ children's health risks and well-being. In fact, we did the first research on LGBTQ youth and families. We developed the first family support model to help families learn to support their children. And we train on this work across the US. We work with families and LGBTQ children and youth from all backgrounds. And in particular, our focus is on helping families learn to support and affirm their children, even when they believe that being gay or transgender is wrong. So our aim in developing this work was not just to do research, but to do research to practice, to do research that would impact policy, that would impact education and training, and of course, that would frame family services and engage families in their LGBTQ children's lives. Our research has a number of different components. We started with a very in-depth qualitative or interview-based study with LGBTQ young people and families from all different kinds of lived experiences who were in urban, rural, suburban, farm worker communities. We did in-depth individual interviews with those young people and their families, and we generated thousands of pages of transcripts in English and Spanish where we learned about their lives and all aspects of their lives and their cultural worlds. And in particular, in those interviews, we identified over 100 specific behaviors the parents and caregivers used to respond to their LGBTQ children. More than half of them were rejecting and more than half were accepting. We took those behaviors and we studied many other aspects of LGBTQ young people's lives, and we did a follow-up survey where we looked at how did those behaviors contribute to risk and well-being, and what were some of the other experiences that impacted the lives of LGBTQ adolescents when they were a little bit older as young adults. We took all of that information back to families and young people. We spent about 2 years just doing that part of our work, and we did it in several different languages with diverse families and LGBTQ youth. And we really wanted to learn how to message this information, how to talk about it, how to frame it, what helped families change behaviors, what helped them understand that how they were responding to their LGBTQ children had a powerful impact on their children's risk and well-being, and how did we do this work in a cultural context, because that's what grounds our work. And all of that information helped us develop a family support model, which we've been implementing in diverse settings. These are actually some of the more than 50 family rejecting behaviors that we identified and measured. You'll see them, they're pretty common across cultures. Taking an adolescent, a child to a therapist or a religious leader to try to change their identity, ridiculing or verbally demeaning that young person, denying their identity, it's just a phase, preventing them from learning about their identity. There were more than 50 of these behaviors that we identified and measured, and then linked with risk in young adulthood. And then there were more than 50 family accepting or supportive behaviors that we identified and measured. Supporting a child's gender expression, extremely important. Believing that your child can have a happy future. Behaviors that all parents can do even when they're struggling, such as just simply talking with your child and listening respectfully to learn and understand about what's happening with them, what's happening with their identity, what are their challenges, what are their hopes, what are their dreams, requiring that other family members treat that LGBTQ young person with respect because they're a member of the family, standing up for them when others mistreat them because of who they are. And we showed how these behaviors help protect against risk and promote well-being. These are some of the images that we actually use without all of these numbers to show parents and caregivers how the presence and frequency of these specific rejecting behaviors impact risk. So you can see that as the number of these rejecting behaviors increase, so too does the level of serious health concerns for that LGBTQ young person. So for example, with a lot of those rejecting behaviors during adolescence, by the time they're a young adult, they were reporting a 6 times greater likelihood of high levels of clinical depression, or a 3 times greater likelihood of using illegal drugs, or putting themselves at high risk for HIV infection, or a more than 8 times greater likelihood of attempting suicide at least once. And of course, all of these behaviors were cut significantly, typically in half, or even lower levels of risk in families with moderate levels of these rejecting behaviors. And so showing a very clear infographic at the bottom of our Healthy Futures posters, we're really showing the viewer, the parent, the caregiver, the religious leader, the youth, that as these rejecting behaviors increase, so too does the level of risk. And even with moderate levels of rejecting behaviors, a 2 times greater likelihood of attempted suicide or 3 times greater likelihood of high levels of clinical depression is really very serious and significant. So what does family rejection look like? These are part of the social media memes that we've created with our work with the Upswing Fund to engage young people and families and others out in the Ethernet, if you will, showing them that not letting your child participate in LGBTQ support groups, events, and activities is a rejecting behavior that contributes to risk. And these memes are used on different social media platforms to connect the viewer with the new online resource that we've created with our work with the Upswing Fund, or ridiculing or calling your child hurtful and harmful and derogatory names. This is a very powerful rejecting behavior that has a long-term impact on that young person into adulthood. In terms of family acceptance, we identified and measured a number of different positive outcomes. And one of the important things for a young person is when their parent or caregiver believes that their child can be a happy LGBTQ adult. This has a powerful impact on their sense of hope, on their sense of the future, on caretaking behaviors, on the relationships that they have as a young adult, even on their ability to plan for the future. And we've shown in our research how increasing family accepting behaviors help increase wellness, like higher self-esteem, better family relationships, better overall health, and also much lower levels of depression and suicidality and substance abuse problems. And what does family acceptance feel like? Well, it's welcoming your child's LGBTQ friends and partners and having them be part of ongoing family activities, as parents and caregivers and families typically do with their children's friends and family friends and partners. It means using your child's chosen names and pronouns and helping them with other family members understand how important this is and how connected to wellness and risk reduction and supporting and affirming that child's identity. One of the, I think, most distressing aspects of doing this work is that all of these family behaviors that are rejecting are focused on trying to change that child's identity, to prevent, deny, or minimize it, even though we typically, as a community, just talk about trying to change your child's identity formally by taking them to a therapist or a religious leader. But that's just one of the more than 50 family rejecting behaviors that we identified and measured. The family rejecting behaviors that we identified and measured happen anywhere. They're ongoing and they are connected to a really important part of that child's life, their parents, caregivers, family members. And another, I think, very concerning part of this is that most parents don't know that these behaviors are harmful and that they contribute to serious increased health risks for their child. They typically see these rejecting behaviors as caring for their LGBTQ children, helping them fit in, helping them have a good life, keeping their family together. And if they're religious, for example, keeping them together in the afterlife. Young people experience these behaviors very often as traumatic, so that minimizing or trying to prevent or discourage these identities has really culturally been the default position across our cultural worlds. These rejecting behaviors are normalized so that many LGBTQ young people expect these rejecting experiences and don't realize how they impact self-esteem, risk behaviors, relationships, even their ability to care for themselves in the future. And sadly, some of them see these rejecting behaviors as the very price of staying connected to their family, their culture, and their religion. And these behaviors are transmitted through culture, and we learn these behaviors intergenerationally so that they're really just part of our daily lives. These are some of the components of the work that we've been doing over the past 20 years. We've developed a family support model and a variety of different kinds of approaches to tell the story of this work and to help families learn to support and affirm their children in the context of their cultural worlds. We developed early on best practice booklets, family education booklets in several languages, and we started a faith-based series to help them understand how to support their LGBTQ child and how powerful their behaviors are in contributing to risk and well-being. We also developed a series of Healthy Futures posters. There are 10 language versions and a version for American Indian families and communities. There's a poster on family acceptance with accepting behaviors, poster on rejection with an infographic on all of them at the bottom, and what I call a conservative acceptance version that doesn't mention a doorstopper in conservative communities, which is dating, having a same-sex partner. So we have other family accepting behaviors in this poster, and it doesn't really talk about dating. One of our frameworks is harm reduction. Doesn't have to be all or nothing. You can start anywhere to begin to decrease your child's risk and increase well-being. And these posters come with a 2-page poster guidance that gives background on them, information about how to use them, and how these can help decrease risk and increase well-being. We're extremely excited over the past year with the support from the Upswing Fund to have developed the first online resource, a comprehensive resource for LGBTQ youth and families that provides direct access to support services. We wanted to create a resource where diverse LGBTQ children, youth, and families could quickly get access to information to help decrease risk and increase connectedness and well-being. There was no central resource where youth could send their parents and caregivers who could directly access a range of support services across the US, and where youth could quickly find support services in their communities and online, including the largest list that has been compiled yet of affirming culture-based resources and faith-based resources. So we created this online space that would be easy to use, including in communities with more limited bandwidth, and will continue to add to the site as we identify and develop more resources. And you can see here some of the kinds of resources that are on the site, including this national searchable map of services, support services across the US. That's a brief overview of some of what we've been doing over the past 20 years. And I look forward to talking about this, answering some of your questions, and sharing more information. And I encourage you to visit our new website and the Family Acceptance Project's website and get more information. Thank you very much.